Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. Today, I'm going to share with you a very important case that we should pay attention to in order not to overdiagnose a patient. This is a case of intramuscular lipoma-like Hibernoma. So this is a 59-year-old male patient who presented with the left thigh intramuscular mass. And on imaging, actually, the mass was enhancing, and on PET CT scan, it was also showed high SUV uptake, which really led to the assumption that this is a malignant tumor. So the mass was excised. And as you can see on low power magnification, there is a tendency for lobule formation of the mass, and the mass is composed mostly of proliferation of fat cells. So the lobule formation is actually an important clue to the diagnosis of Hibernoma in general. Now, at high power magnification, most of the cells composed of cytoplasm with fine vacuoles, as you can see here and here and here. And as you know, Hibernoma or brown fat shows usually this fine vacuoles in the cytoplasm of the tumor cells. The nuclei sometimes tend to be slightly pleomorphic, perhaps with some prominent nucleoli, and usually this component is the one that shows the increased uptake on PET scan. Now, other areas in the tumor shows only tumor cells with univacuoles, only one vacuole in the cytoplasm. This is the lipoma-like part. And in other areas, we have like the intermixture of both components, the component with the only single vacuole in the tumor cells, and the component with multiple vacuoles, as well as a nuclei slightly hyperchromatic with a prominent nucleoli. And this part actually is what might lead to the erroneous diagnosis of liposarcoma or atypical lipomatous tumor, because of the misinterpretation of this part or of these cells as lipoblast. So remember, these tumor cells are nothing but the Hibernoma or the brown fat component of the tumor, and this is the better differentiated component with only single vacuole in the cytoplasm, consistent with the lipoma-like. Now, only 20% of cases of Hibernoma in general can show this intramuscular growth pattern. Again, it's an important tip that should not be misinterpreted as infiltration or invasion of the pre-existing muscle tissue or muscular fibers, and thus to the erroneous diagnosis of liposarcoma. So to sum up, this is a case of an adult male patient with intramuscular mass that on PET CT scan was interpreted as potentially malignant. However, on excision, it shows this very important clue to the diagnosis, that is lobulation of the growth pattern and the presence of two components, the Hibernoma component, the brown fat component with fine evacuated cytoplasm, central nucleus, prominent nucleolus, and then the better mature component, the lipoma component, that shows only a single vacuole in the tumor cells. Remember that these tumors are completely benign. They should not be misinterpreted as malignant or as atypical lipomatous tumor. Now, one last thing, these tumors are typically MDM2 negative, so this immunohistochemistry might be useful to support the diagnosis that this is not a malignant or atypical lipomatous tumor. I hope you find this tip useful in your daily practice. Thank you.